Capsulotomy in congenital cataract surgery using the Capsulaser innovation. Here is two cases of one patient, both eyes, right eye and left eye, with congenital cataract. The age of the patient is 7 years. I started with the left eye, then I did after 2 days the right eye. Here is the right eye, which I start later after 2 days from the left eye after doing 2 paracentesis. And mydriatic agent was injected to dilate the pupil using the HPMC, then injecting the capsule blue to stain the anterior capsule. After 1 minute, washing out the capsule blue and injecting the viscoelastic sodium hyaluronate 3%. Then here is focusing the circle of the laser on the anterior capsule. You can see a beautiful, well-centered, well-sized. Actually, the size of the anterior capsulotomy it was 5.3 millimeter. As this type of cataract is soft, so I use the bimanual irrigation aspiration to remove this soft cataract after doing the hydrodissection course. Here is the hydrodissection, and using the bimanual irrigation aspiration to remove this type of this soft cataract. Then the same thing, using the HPMC over the cornea, restain the posterior capsule using the capsule blue. Then after 1 minute, wash out the capsule blue from the AC and from the capsular bag, and injecting the sodium hyaluronate 3% to form the anterior chamber and the capsular bag. Then applying the Capsulaser. You can see that laser circle on the posterior capsule, focusing on the posterior capsule. Then you can see in slow motion the cutting of the posterior capsule, the capsulotomy, with some tags as it's clear. Then using the Rix's forceps to remove this posterior capsulotomy without doing any turbulence in the anterior hyaloid phase and in the vitreous. It was easy to remove it, as you can see. After removing this posterior capsulotomy, 3-piece hydrophobic and foldable IOL was implanted inside the capsular bag. The haptics, as you will see inside the capsular bag, and you can see also the size of the posterior capsulotomy is less than the anterior capsulotomy. Actually, the anterior capsulotomy is 5.3 millimeter, and the posterior I make it 4.8 millimeter. Then gently pushing the edge of the optic to capture through the posterior capsulotomy with the haptics inside the capsular bag, as you can see. Then bimanual irrigation aspiration, removing the viscoelastic and wash out the viscoelastic from the anterior chamber, and here is the end of the surgery. Let's go now to the second eye, which I start 2 days before the right eye. Here is the left eye. Also the same step, injecting mydriatic agent after making 2 paracentesis. Here is the main phaco incision, HPMC over the cornea, injecting the Capsulaser, and after 1 minute, wash out the Capsulaser, wash out the capsule blue, injecting the capsule blue. After 1 minute, removing and wash out the capsule blue from the AC and putting sodium hyaluronate 3%, and you can see in slow motion 5.3 well-centered, well-sized anterior capsulotomy using the Capsulaser technology. Now go again for HPMC over the cornea, re-inject the capsule blue to stain the posterior capsule. After 1 minute, wash out the capsule blue, inject 3% sodium hyaluronate to form the anterior chamber and the capsular bag, focusing with the Capsulaser circle with the circle of the laser on the posterior capsule with 4.8 millimeter posterior capsular Rix's size, which is less than the anterior capsulotomy. You can see here also a complete cut with only 1 tag of the posterior capsulotomy. The same thing, removing the the posterior capsulotomy using the capsulated forceps and the 3-piece IOL implanted. The same thing you can see here, the anterior capsulotomy 5.3 millimeter, the posterior capsulotomy is 4.8 millimeter. As this machine, you can adjust the size of the capsulotomy from 4 until 5.5 millimeter with 0.1 millimeter increments. As this child, so I used 10 of microsuture in the main phaco incision. Then you can see the optic capturing the posterior capsulotomy, removing the viscoelastic, and from the antechamber and from the pocket of the anterior and posterior rim of the capsular bag. Then stromal hydration for the paracentesis and for also the main incision. Here, while doing the right eye, the second case, I took picture for the left eye by the microscope for the left eye. Here is the left eye, and thank you for watching.